Good morning, it's Dr. Hodges, and today I want to talk about medical weight loss and surgical weight loss and weight maintenance, and how can we do it, and what is best for each. So, I'm a board certified surgeon. Been doing bariatric surgery since 2011, and whenever I went out on my own, and in 2016, I opted to start to incorporate medical weight loss into my practice. So incorporating non-surgical options. And in my practice, medical weight loss program is a mix of metabolic testing, specialized diet, nutritional counseling, psychological counseling, and using medications to help to curb appetite and to curb cravings. And all of those, you really need all of those to work synergistically so you can have the best long-term results. So it's not uncommon for me to have referrals. Good morning! Referrals to my clinic from a primary care doctor or maybe from a friend for a patient that needs to lose weight, and yet maybe the patient has never considered surgery before. And sometimes it can be a really difficult kind of topic to broach, especially if it's like your own family member, to say whether or not somebody really needs surgery or is somebody a good candidate for surgery. And I think that this is for a number of reasons. Number one, there's a huge, I feel like now more than ever, a really big disconnect as to what we consider a healthy weight. I've said this before, that especially here in Dallas, people are either this big around or they're big around. There's not really a happy medium. And we have so many different cultural norms right now as to say what is considered healthy and what isn't. And that makes it incredibly difficult as a weight loss specialist, because I have to weed through all that bad information and muck and things that we've been taught and encouraged to think about what a good healthy weight is. And whenever I say healthy weight, I do not mean a string bean and you're going to be in Sports Illustrated. What I'm talking about is a good healthy BMI. And whenever I say a healthy BMI, I've also seen many TikToks and Instagram and Facebook posts and blogs that will say, oh, BMI, it's this bad norm that was created and it doesn't apply to everyone. Well, the reality is this. Number one, all it is a ratio. It's a ratio of your weight to your height. That's number one. And number two, it really is only skewed truly for people that are like weightlifters, or maybe if you're like an athlete at a really high level where your body fat percentage is very low, but you have a much higher muscle mass, and muscle weighs more than fat. And so certainly you could have somebody that may appear to have a very high BMI, but maybe their body fat percentage is like 5%. And so certainly in those cases, it's going to be skewed. But what we're finding is that these different BMI ranges, they didn't really think them up arbitrarily. What we're finding is in a lot of our different studies, when we're looking at heart disease, diabetes risk, long-term longevity, things like that, we are looking at ranges of BMI. It's not that we're trying to make somebody feel good or feel bad. It really is just a number. That's all it is. It's just a number. But we have a lot of research that will back that certain ranges of these BMIs really can show somebody's risk for being how healthy or how unhealthy that they may or may not be. So let me just kind of throw that out there. And I'm just trying to get people healthy. I want you to live a nice, good, long, healthy life. So whenever I have a patient that comes in to see me, and maybe they had never considered surgery before, so maybe they were a referral. This is the most common time whenever I get this question, where people really are just not sure, should I get surgery or should I do something medical? And I think it comes down to a number of factors. So let's just say insurance covers the surgery for you. And money is not an object. So let's just get that out of the equation, because certainly that does play a role in some of my patients' decision making. I have a fair amount of patients that do not have bariatric coverage, or they just don't have insurance coverage, and from a financial sense, it's just not something that is in the cards for them right now. And for those people, regardless of what their weight is, we will very aggressively try to implement a weight loss medical plan for them. But what do I do with these patients that come in and they've been referred to me and they've struggled with their weight all their life? And I essentially have 20 to 30 minutes to try to convince them why one program would be better than another. And, you know, I always feel, you know, a little bad for some patients that by the time somebody is referred to me, it's not because they haven't been trying to lose weight. It is, I am never the first person that somebody will come to whenever it's the very first time that they've tried to go on a diet. Every one of my patients, regardless of how they found me, whether it's through a friend, internet, referral from a doctor, they've tried like literally every diet on the market. They've tried, you know, Atkins, and they've tried paleo and the cabbage diet. And I remember whenever I was a little girl, grapefruit 45, I mean, Dexatrim, I mean, that you name it, they've tried it. So it's not because of a lack of trying. And I've had several different videos that I've made talking about just the genetic components and why patients may or may not have issues with their weight. That's another talk for another time. But how do you make that decision? So, you know, if I have a patient that is coming to see me and maybe they truly need to only lose 20, maybe 30 pounds. Maybe their BMI is 28, or I'll have some ladies and they're trying to, in a short period of time, undergo IVF or IUI, or maybe somebody needs to lose 30 pounds or so they can get that orthopedic surgery. With those patients, a lot of times, regardless of what their weight is, then I can usually help them lose that weight from a medical weight loss program. With the caveat that depending on where their weight is, that kind of determines how long it will take them to lose that weight. And this is what I mean. For me, my basal metabolic rate is 1,087. That is why I'm out walking right now. And so for me to lose a pound a week, I need to be in a 500 calorie deficit. That means on any given day, 11 minus 5 is 6. So I would have to net between 600 and 700 calories a day. I'm never going to tell anybody to do that. And so for me, because my basal metabolic rate is so much lower, I do keep my calories around 1,000. I take medication to help me there. But then it's important that I do some aerobic exercise, because it's really going to be the exercise that's going to be driving the deep calorie deficit that I need so I can lose weight. If you weigh more, then your body requires more calories to maintain that weight. And so you can go into a calorie deficit more easily just with diet alone, which is important whenever I have patients, especially that come to me and they need orthopedic surgery. They have bad knees, bad hips. They're not about, and if they have 100 excess pounds, they can't go out and exercise. They can't go for a walk. I mean, it's not because they don't want to, like they physically cannot. And so, with patients like that, then if you're only needing to lose 20, 30, maybe 40 pounds, medical weight loss can work very well, regardless of what your insurance coverage is. And we definitely have studies that have shown that even a modest weight loss, so 10% of your excess body weight loss, you can have a really good positive impact on your high blood pressure, on diabetes, things like that, regardless of what your current weight is. And so for those patients, excellent candidate for medical weight loss. Or let's say it's somebody that's already had weight loss surgery and they want to get off that last 20 pounds, or maybe it's somebody that wants to help to maintain their weight, whether they've lost it with medical weight loss or they're a post-bariatric patient and they just want to help with weight maintenance, then a really good, strong medical weight loss program is great for weight maintenance. But what about a patient that comes to me and they truly need to lose, ooh, it's getting noisy. They truly need to lose 60, 70, 80 pounds, whether it's just for health. Ooh, you know what? I'm going to pause this and get past this noisy part. Okay, had to get past that little noisy part. So, what do you do whenever you have 50, 60, 70 pounds to lose? Does that mean that you cannot lose weight with a medical weight loss program? That is hands down, emphatically not what I'm saying. What I'm saying is that it does become much, much more difficult for somebody to do so with a tool that is not that powerful. The reason whenever I have a patient that comes to see me and their BMI is over 30, over 35, and they have that much weight to lose, I know in my experience that you are going to reach your weight loss goals much quicker and have much more sustainable weight loss with a surgical procedure, regardless of what that surgical procedure is. And it's simply because surgery is just so much more a powerful tool. You know, all the research shows us that with surgery, about 80 to 85% of the patients are going to have good long-term success. Compare that with any one of the medical weight loss programs out there, probably going to have about 2% efficacy rate. And so if I have a patient that's coming to me, regardless of why, whether it's they want to lose weight, whether they need to lose weight for surgery, they want their diabetes to go away, regardless of the reason, if they have more than 60, 70 pounds to lose, surgery is always going to be the best option for them. And you know, and that can be scary and that can be a difficult thought to sometimes process, because there's a lot of bad information out there. And also, if surgery's never been contemplated to them before. But I kind of liken it to, you know, if somebody has really, really bad heart disease, maybe they've never really taken care of themselves that well, or maybe they've had certain lifestyles where it's exacerbated their heart disease, or maybe they just have a really strong genetic component to have really bad heart. I have a really good friend and her husband has had a heart attack, but everybody else, everybody in his family, all the men in his family has had heart attacks, and they've lived fairly healthy lives. That's a very real thing. So that, like I said before, your weight is like no other, it's like every other disease. There's a strong genetic component to it. And so regardless of the why you need to lose weight, I can tell you the how to lose weight is always going to be surgery is a much better tool compared to just any medical weight loss program. And surgery, like I said, is just a tool. It's no different than any other medical weight loss program in that you have to maintain it. You have a lawn, you gotta mow it, if not it becomes unruly. You got a cat in a kitty litter box, you gotta take it out and take care of it, or it's gonna be a hot mess. If you were a guy that trained a lot in high school or maybe in college and you played football and you wanted to maintain that mass, you know you cannot maintain that mass unless you're consistently working out and eating a certain way. Weight loss and weight maintenance is no different. I mean, it's just like any job that you have. You can't just go on autopilot and think that the projects that you're working on are going to do well. It is something that you always have to cultivate. I mean, that's like even in your personal relationships, you can't just put your marriage on autopilot or your best friend, that friendship on autopilot, and think that it's going to be maintained. It's something that you're always going to have to pay attention to and cultivate to make sure that it is the best that it can be. That's going to be the same with your health and your weight. If you just try to put it on autopilot and not try to be actively involved, then unfortunately you're just not going to have a good long-term result. And that's regardless of how you get there. So what does all this mean to say is, in my professional opinion as a weight loss expert, Do I think that weight loss is achievable regardless of how you get there? Absolutely. However, do I also think that weight maintenance is something that is a lifelong project? Absolutely. And it needs to be an active, ongoing process. And just like anything else in life, you're going to have hills and valleys, waxes and wanes. But overall, if you're doing the things you need to do 80% of the time, and then the other 20% you're just living your life, probably going to do okay. But I think my other take-home point is, if you know in your heart that you have more than 50, 60 pounds to lose, you truly are going to do much better with a surgical procedure. They're much, much safer than they were in the past. Recovery is better. And the reality is that they just work better and you have better long-term results. So I encourage you that if you have issues with your weight, or if you have issues with high blood pressure or diabetes, really do some research to see what are all the different options that are out there, because you just may be surprised that the one that you thought didn't really apply to you does, and it can just open up a whole new world for you. So hope that this helped. Look on my Instagram. I have a number of different blogs that talk about medical weight loss, that talk about surgical weight loss, and really see what kind of works for you. It's also not uncommon for me to have patients that maybe they do need to lose a significant amount of weight. From a surgery standpoint, they just aren't there for whatever reason. And oftentimes I'll start a medical weight loss program for them and do that for about 3 months, for 90 days. And then we kind of regroup to see, what are you thinking about the results? What is your lifestyle like? And then we kind of take it from there. So where there's a will, there's a way. So hope that this helped you guys. Bye.